Dear viewers, this story about alcohol and stroke. After completing his high studies, Sam was seeking employment and moved to city. Full of dreams, he traveled and reached the place where he was invited for an interview. For his hard work, dignity, and skills, he was selected to work in that modern organization with fruitful income. Few months later, entertainment parties are organized by group members as usual. Let's party and hit the floor. He started to have fun and entertainment with his friends as occasional. His parties are organized out of his friend circle too. The habit of drinking alcohol increased day by day in his life. While other people celebrate and limit their intaking, Sam got addicted to alcohol eventually. He thought his brain was happy in the beginning. Sam continues to have alcohol every night at home. In few months of usage, changes occurred in his body. Needed to pass urine frequently, even at night. Dehydration increased with the effect of alcohol. Dry mouth also the sign of dehydration. He starts to feel constant tiredness and weakness physically. He ends up showing lack of performance in his work. But Sam didn't stop the alcohol consumption. Continued to have every night. He was misunderstood that alcohol gave him energy to perform well in his daily activities. One fine evening, Sam was home alone. He identified some abnormalities suddenly occurred in his body. First dropping, one side of the arm showed weakness, speech difficulties, unexplained dizziness occurred, and also severe headache to one side. Blurred vision. The good thing he did was, without waiting, immediately he called for emergency service 911 and explained the condition. From emergency service arrived and admitted him at the hospital very soon. After treatments, doctor explained that his condition as stroke. How it happened to him? This is the cause. When the alcohol consumption increases, this will be the risk factor to stroke in many ways. Alcohol contains high sugar. When digested, it releases glucose into the body. Over time, in type 2 diabetes, glucose stays in blood and damages the blood vessels. From intestine, alcohol absorbed into bloodstream and travels to liver. It starts to metabolize. It can metabolize 100 ml per hour only. In liver, ADH enzyme oxidizes the alcohol to acetaldehyde. This is a toxic molecule. It damaging membranes, increase the uneven heartbeat. it will damage the brain also. By the time liver needs to work hard, it causes liver damage. So, blood clots, glucose imbalance, and toxins in the blood. The thrombosis can travel to other body parts and brain as well. Alcohol relates to atrial fibrillation. Heartbeat fast out of rhythm. Abnormal rhythm may cause blood to pool in the heart and form blood clots. This is called thrombosis. The damaged blood vessels with glucose and cholesterol plus might narrow the tiny vessels in brain. It can reduce the blood flow to the brain. The thrombus can block the tiny vessels. It can reduce the blood flow and oxygen to the brain. It leads to damage the brain cells. This is called ischemic stroke. Alcohol will increase the blood pressure. Tiny vessels in brain can get damaged for some cases. Internal bleeding in brain and swelling can compress the surrounding brain tissue and damage them. This is called as a hemorrhagic stroke. Doctor advised him not to use alcohol while on medication and also explained to him the severity of stroke. If it's happened to further high level, it can cause the disability and restricted mobility. Sam doesn't want that happen in his life. He followed the physical activity programs given by the hospital. Sam recovered well in few months and performed well at his workplace. He improved the quality of his life. Sam married to his loving one and started his life without alcohol addiction. Now Sam has a happy family with adorable kids.